There continues to be good news from the Texas Medical Center when it comes to the coronavirus. The number of people hospitalized in intensive care has dropped by 5 people since yesterday, and the number of overall COVID patients is down by 3 people.
The Texas Medical Center's data comes from 9 counties across the Houston area, and tonight they are debuting a real-time coronavirus data tracker now that's offering a much clearer look at the local impact of the virus.
Our Haley Hernandez is the only local television health reporter in Houston. She's live in our newsroom tonight with a look at why this new dashboard is a game changer for our community. Right,
yeah,
Haley?
it really is, Chris. So I was on a call with several leaders of the Texas Medical Center this morning, and they showed me how they're now calculating data of this virus. This is mostly to separate Houston from the state, which we know lags so far behind that it's hard to determine when exactly a spike or a decrease even happened.
Here is the new TMC dashboard. This is where KPRC gets daily updates on the hospitalizations and ICU numbers across the 9 counties where the Texas Medical Center serves. Now, TMC says they've got the best, most comprehensive way of getting real-time data to the public.
There is no delay in the TMC data. So when you look at testing data, positivity rates, people being hospitalized with data, and I think they're very consistently saying right now, okay, we bubble up and down, but we're basically flat now.
The change to the dashboard gives a clearer picture of what's happening in Houston specifically. And President of TMC, Dr. Bill McKeon, says it's proof when social distancing has worked.
When we were in April and May and the mask order came, you can see a direct causal relationship between those decisions made by our leaders and a direct correlation to the data dropping off. Mask wearing, huge implication. And so it usually takes about 2 weeks for anything to happen, whether opening up or putting in mask orders. You see it in our data. You see it in the testing. You see it in the hospitalizations.
The good news, these numbers show Houston has recently had a flat rate, but that comes with a warning from Baylor College of Medicine's Dr. Paul Klopman.
And I've said this to anybody who will listen. If you see a business or a place where it looks like it's pre-COVID, don't go in there. That is just crazy.
Now, the biggest benefit to keeping up with this data in real time is we can see pretty soon what works and what doesn't work. For example, schools opened 3 weeks ago, and it appears that there has not been a big surge in COVID cases. McKeon says that's because schools are enforcing masks. And get this, he says if 75% of our community wore masks, we can make this virus go away. Lauren?
Okay, according to these doctors, how much longer do they think until we can potentially say the virus is gone?
Well, he does say to prepare for a long winter and spring. It's not going to disappear even if we do get a vaccine early next year, because 60 to 70% of people have to get vaccinated to really get control of the virus. And no matter when a vaccine is approved, it's going to take a while to get people to actually go and get the shot. So he says, keep doing what you're doing. Don't let these downward trends lead you to complacency, because they say it is working. Chris.
All right. Haley Hernandez, thank you for that.